How are you doing after pandemic? Many of my patients are experiencing unexplainable symptoms these days. Younger generations are facing more cancers and women are seeing abnormal periods. For men, not only they are feeling fatigue, but they are also experiencing erectile dysfunction. I found an interesting study about the correlation between COVID and erectile dysfunction, and I will share what could cause ED from COVID. And I have prepared a series on this topic. Make sure to subscribe to the channel and get all the benefits. Are you ready? Let's go. In this study published in 2022 in Nature, they conclude that COVID affected men more than women, and it affects severe disease that can cause ED. During the pandemic, with more than 150 million infections and 3.5 million deaths, the rate of ED diagnosis increased. There are three hypotheses of how COVID could cause ED based on this study. To understand the first hypothesis, let's talk about the endothelial dysfunction. Beyond the common symptoms of COVID-19, the virus can trigger a series of events that affect the endothelium, the inner lining of our blood vessel. Especially ACE, angiotensin converting enzyme, receptor infection cause this problem. The endothelium is like a dynamic highway system in our body that regulates blood flow. When COVID enters the picture, it's like causing a traffic jam on these highways. This traffic jam or endothelial dysfunction can lead to problems in different organs, including those responsible for intimate moments. So imagine your body's road getting a bit blocked, causing some issues downstairs. What's worrisome is that studies show endothelial dysfunction isn't just limited to the intimate area, it can affect multiple organs. This gives us a broader understanding of how COVID impacts our overall health. The virus can compromise the normal function of a blood vessel, potentially contributing to a range of health issues beyond erectile dysfunction. Now, let's explore the second hypothesis, the testicular connection. COVID seems to have a unique interest in a specific part of our body, the testicles. The virus can infiltrate and affect the cells there, such as the sertonic cells, Leydig cells, and the ones related to testosterone production. The testosterone is like the hero of our love life, responsible for maintaining sexual function and desire. So, when COVID messes with our testicle, it directly affects our romantic side. Research suggests that the testicle have a high concentration of ACE2 receptors, the cellular getaway for the virus. This vulnerability shed a light on why certain individuals may experience hormonal changes post-COVID. Studies have shown that individuals infected with COVID might experience lower testosterone levels. This isn't just about the intimate impact, it raises questions about potential long-term consequences on reproductive health. Researchers are actively investigating how COVID affects the delicate balance of hormones in the male reproductive system. Moving on to the third point, the psychological impact of COVID. It's not just about physical challenge. The pandemic brought along a wave of stress, fear of getting sick, change in our daily lives, and social distancing. All this stress can weigh heavily on our minds, impacting our romantic performance. Imagine trying to focus on romantic moments when your mind is preoccupied with worries. It's like juggling too many thoughts at once. What's crucial to understand is the various psychological factors, including anxiety and depression, that can contribute to erectile dysfunction. This broadens our perspective on interconnectedness of physical and mental health. Studies have indicated that individuals experiencing high levels of stress during the pandemic may be more prone to sexual difficulties. The uncertainty, fear, and change in daily routine can create a perfect storm for disruption in our intimate lives. Recognizing the psychological aspect is vital for a holistic approach to addressing erectile dysfunction. Now, let's talk solution. I have prepared 3 steps to defeat ED and low libido. But if I were to cover this now, it would be another 10 minutes. So today, I'm just gonna give you a preview and I will come back following week with more details. As you can see in this picture, take 6,000 milligrams of arginine 20 to 30 minutes before the promised time. Do 20 to 30 squats slowly and take a shower, ending with the cold shower for about 30 seconds to 2 minutes. You can do the squats in the shower. I will explain why on the next video. Maintaining a healthy lifestyle, staying physically active, and finding ways to manage stress can positively impact your overall well-being. It's not just about addressing the symptom, but taking a holistic approach to the health. Please don't forget to like and subscribe to the channel. I will come back with a full review of studies on the effectiveness of maca root, one of the most popular supplements for ED and men's health, and how to tackle ED and libido next time. Health is wealth, so invest in yourself. This is Dr. Sean, making health easy for you. Stay healthy, stay happy. Bye!